Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram. Hey, Carl. How's it going, buddy?
I'm good. What's happening, brother?
Just living the dream, getting to talk to you on a podcast. What could be better?
It is our dream. I don't know if it was my dream as a kid. If somebody would have told me as a kid, like, you're going to be talking on a podcast with this guy from New Jersey, I would have been like, what?
Wait, can I change this dream? It's not as good as if we were out on the court playing pickleball, though, is it?
No, except for it is fun to play you all in pickleball. The problem is I'm terrible at pickleball, and I'm the worst of our friends by far. Like, I think we can all agree upon that. I
was going to try and say something positive, but I think actually you might be the worst. Yeah.
I'm okay. I'm comfortable with that as my role. As long as the problem is I can't get anybody to go for a run with me, except for maybe one of our friends, but.
You're like 40 times better at long distance running than all of our friends, and you're about half as good at pickleball. So I think you come out net positive.
Half is generous.
A third? Yeah, I'm not sure.
There you go. I'm comfortable with a third.
Well, pickleball, in case you haven't noticed, is a big pastime amongst not just our core group of buddies who like to go out and play pickleball and families who like to go out and play pickleball, but I don't know if you've heard, it's the fastest growing sport in America, Carl.
I've also heard it's the fastest sport, or it's the sport of the future. ... Injury.
Yes, exactly. So, pickleball is definitely on lots of people's minds, and we had we wanted to get a chance to talk about, the benefits of pickleball, the risks of pickleball, and the limitations of pickleball. So, I can't believe we're actually doing a podcast about pickleball, but apparently it's that popular that we've been asked multiple times to talk about pickleball. Yeah. So, for those of you who aren't familiar, pickleball is basically playing table tennis while standing on the table, right? I mean, it's like a small tennis court, much smaller than a tennis court, similar rules to ping pong. You're standing, you're playing with paddles and with a large wiffle ball. And we're not going to dive into the specifics. Go to YouTube or Google pickleball and you can figure it out if you're not already playing. One of the interesting things about it, though, is that it is really, really popular with the aging population. So where we really see people picking up pickleball, like the demographic tends to be largely people in 50s, 60s, and 70s. Although if you go to the courts around the corner from my house, there's people of all ages playing. And it's certainly not just for older people, but there is there's a lot more 60-year-olds picking up pickleball than there are 60-year-olds picking up endurance running. So it's definitely growing rapidly there. So is it good for people? Well, the really interesting study out of Utah in the International Journal of Environmental Research and Public Health. And this looked at pickleball for inactive midlife and older adults in rural Utah, a feasibility study. And what they basically did is they took about 20 or so midlife and older adults and had them pick up pickleball. They looked at how they did from a subjective perspective. So did they enjoy it? What was good about it? What was bad about it? They looked at muscle function in the sense of grip strength, their vertical jump, as well as their chronic pain scores. And they followed these folks over a number of weeks to see how pickleball affected their life. And, interestingly, vertical jump increased by about an inch in folks who'd been playing pickleball. Statistically significant, pretty interesting.
Yeah.
and no real significant change in any of the other markers other than pain. So you might think, and here's foreshadowing of the talk we're going to do around adequate recovery, you might think that chronic pain scores would potentially increase in folks who are now subjecting themselves to a sport, and yet no, exercise remains the best medicine, and
Right.
people's chronic pain scores actually decreased from a median score of 3 to a median score of 2, which was statistically significant. No changes in blood pressure, resting heart rate, or grip strength. And if you surveyed these folks about the positive aspects of their intervention, the themes were really, hey, this is easy to learn, even if you're not that good or in great shape. It's fun. The socialization aspect is huge. You're like meeting new friends. There's, doubles is a big part of pickleball, and most of the time, the older population is playing doubles pickleball. The negatives were, hey, sometimes the weather's not great. We're playing outside. That seems like you could find an indoor place to play. And then one of the benefits that I thought was really cool, so like improved overall sense of well-being, mood, and self-confidence. We're going to talk about that in a minute. Activities of daily living seemed less strenuous and daunting after playing pickleball. So just things like going grocery shopping and taking care of your business. And then good springboard to other sports and forms of exercise. So, kind of one of those studies I look at and kind of giggled at the title, like, really,
Yeah.
you're going to do a pickleball intervention for midlife adults who don't really do very much and see what happens. And yet, pretty impressive results, right? These folks felt better afterwards. They had measurable markers, vertical jump and chronic pain that improved. And they were like, this might actually get me into doing more stuff.
Yeah, I'm impressed with the vertical jump increase. Like, if you're, I think half of the people playing pickleball in the U.S. are over 55. If you're increasing somebody's vertical jump by an inch and you're over 55, I respect. That's hard to do.
Well, and I think if I'm going to sprinkle just a little realism on it, the people who make the most impressive gains the most rapidly are people who are doing very little to begin with.
Yeah,
right.
Sure.
So not that's, you see these strength gains in folks who start lifting weights that are amazing when they start off, and then they sort of slow down and plateau. But that's amazing. Like, if you're taking people who are sedentary and can't get into doing some sort of regular exercise, or they're demotivated, and now all of a sudden they like going out and doing stuff that's good for them, that's amazing. So liked that study. I also found a study.
Yeah, I think of vertical jump. You're right. I'm thinking these NFL players, if they increase their vertical jump by an inch, you're like, hey man, that guy's been working.
Well, that's the thing. That's like unheard of in a professional athlete to increase it an inch from pickleball. Sorry, that's not happening for any of the professional athletes listening. But and also, if you told me that it increased your grip strength significantly, I would say, wow, this could be a really good translation into longevity and functional strength in an older population. But when you're, I'm not sure how many of these 60, 70-year-old folks are starting to pick up basketball squads and are now at an advantage because they've got a better vertical. So we'll see. One of the other things, and I think to me, the greatest promise of pickleball as an intervention for older adults is around mental health and cognitive performance. And this was really cool. So Frontiers in Psychology from this year, from February of this year, Pickleball and Mental Health in Adults, a systematic review. And like all systematic reviews, they went through a big literature search. They whittled down the papers. They found 63 papers, and ultimately 13 of those met criteria. And a total of the population here, a total of 91% of the population were people over the age of 50. And basically, these were studies looking at cognitive performance and multiple other variables in psychologic and mental health in people over 50. And they showed significant improvements in personal well-being, life satisfaction, depression, stress, overall happiness. So like that's a lot of potential as a new tool to improve mental health that also gets people out and socializing and moving their bodies. So
Yeah.
pretty impressive. I wasn't able to track it down, but Trey, who's one of our health coaches, has been on the podcast, had found some interesting literature. I'll try and ping him for it on improvements in hand-eye coordination and cognitive processing in older adults playing pickleball as well. So lots of great reasons to do it. So like anything, we're going to treat pickleball like it's an intervention, like a medication or a supplement or a training program. What's the downside to pickleball?
I mean, I would say, the way I think about pickleball though recently is just because I've just hear this from, I don't work in the emergency department anymore, but I have friends who do, who kind of roll their eyes about pickleball a little bit just because of the increased injury rates that they've seen. Not just you think of like knee injuries, ankle injuries, but also like wrists and shoulders from falls, outstretched hands. I know there was a study out of the Journal of Emergency Medicine that showed an increase, and I was trying to trace this down, but the actual annual increase from like 2013 and 2014, but this study was published in 2019 that showed 19,000 injuries nationally from pickleball, and that had been like a steady increase over that time frame. So, but that is aligned with like the rate of, actually it's probably not even aligned with the rate of increase of people doing pickleball, frankly. So I think it's people doing activities that they haven't done before, are not trained up for that, and have, significant sprains that set them back on any, or fractures, of those 19,000 patients I quoted, like 28% were just like strains and sprains, but 27% were fractures, lower extremities, and 25% were upper extremities, which is like, those are big numbers from emergency department data. But I think that probably what you're going to get to is, training around that and specific training. But I agree with you. This is like if you can get a modality to get people outside and do exercise from a mental health standpoint, good on you. This is great. I'll promote that all day.
Yeah, it's pretty solid. I mean, I think you're hitting on exactly what I was hoping you would, which is the incidence of pickleball related injuries, right? So if we're going straight for risk, that's what we're talking about. So study out of injury epidemiology from 2021, non-fatal senior pickleball and tennis related injuries treated in the United States emergency departments 2010 to 2019. Not trying to be morbid, but geez, I hope there weren't a lot of fatal senior pickleball and tennis related injuries, but they did. Thankfully, they weren't looking at those. And some interesting stuff, right? So among players over 60 years of age, non-injuries accounted for 11 to 25% of the cases. So non-injuries being things like cardiovascular events. They're not talking about those. They're talking about just injuries. So pickleball-related injuries grew rapidly over the study period, and by 2018, the number of senior pickleball injuries equaled the number of senior tennis-related injuries. So that's just a reflection of pickleball gaining popularity and more seniors playing pickleball. The related injuries were mostly due to slip, trip, fall, or dive mechanisms, all of which does remind me of the movie Dodgeball, but also it makes sense for how you're playing pickleball. And the leading related diagnoses were strains and sprains. So that was around 33% of the injuries. And fractures were about 28%. Contusions next at about 11. So senior males 3.5 more times likely than females to suffer a sprain or strain, whereas women were over 3.5 times more likely to suffer a fracture compared to men, and 9 times more likely to suffer a wrist fracture. So probably a reflection of the gender differences in osteoporosis in the older population for sure, but just worth knowing sort of what the most likely injuries are. Now, if you look through the actual list of injuries, I mean, we're talking everything from eye injuries to facial injury. Like, this is a big review of all of the data, so you see all sorts of weird, freakish accidents in pickleball. But in terms of the likely ones, it looks like sprains, strains, and fractures dominate by a bunch. I will second the contusion one because, as you know, my younger son likes to play pickleball with me. He's better than I am, and his game now is just to try and peg me with the ball. So I definitely have suffered contusions from pickleball.
Yeah. No, his game is way better than yours.
There's no question. Yeah, that wasn't a question, Carl.
Okay. Oh, I'm sorry. I thought you were throwing it up. Sorry, my bad.
As opposed to sometimes when I'm fishing for like a soft compliment from you. No. He's just way better than me. There's no question. And then limitations, and I don't think we need to dwell too long on this. You outlined in a pod we did not that long ago, sort of how you think about training for longevity and training for optimal health, and that you've got to have a component of VO2 max training or high intensity interval training. You need a component of resistance training. You need a component of balance or core work, and you need a component of metabolic training or zone 2 training. Pickleball probably at doubles. Pickleball, I think it's mostly VO2 max, like zone 2 at the most. I don't even know that it actually fits any of those core categories. I'd love to hear where you think it fits in. Balance for sure.
Yeah, that's where I was actually thinking it fits more than anything. And honestly, like I almost put it in balance, but also a little bit, I know this, you're going to pause, but like resistance training almost from the fact of like kind of jarring movements. What I'll have, especially in older females with some osteopenia, like I'll have them do box jumps, and just the jar and like the data around that for increasing their bone density. I kind of think of it as that. Almost
sort of like light plyometrics.
Yeah.
I mean, but you think about the weight bearing. I'll expand / push back a little bit. I think about like the weight bearing that comes from box jumps versus the weight bearing that comes from playing pickleball. I think you're getting a significantly higher stimulus from something like a box jump, or even just like a kettlebell squat or a dumbbell squat. Yeah. Right. I think depending on now pickleball singles, I think you might at times get up to VO2 max training.
Sure.
Right. It's very intense interval sprints. Doubles, you're not really working that hard. Core balance for sure. I think you definitely need, if you're an older adult or even a younger adult for that matter, I think you need to be mixing in some dedicated resistance training and some dedicated zone 2 if you're going to play. Don't just use pickleball as your sole form of exercise. Maybe use it as your gateway to more exercise if you're getting active.
Yeah, I mean, I actually have a couple of people who are on like a pickleball circuit that are patients of mine who, adding strength training for them has made a difference in their pickleball. So I try to think of pickleball as like or any of these type of activities. If people like to do golf or they like to do tennis or whatever activity they enjoy doing, and maybe it's not always like, if they're cycling, it's sort of different, or, depends on what the activity is. But actually, if that's what you like to do, using that as a motivator to be like, hey, if you do all this strength training and you like, you love doing golf or you love, and adding these other components like your shoulder mobility and mobility work with that core and balance stuff, strength training is going to make a difference. And doing zone 2 cardio, like it's all going to actually help your performance on this thing that you love. And so that's the way I try to talk to people about it. As opposed to being like, okay, like, let's have this be your sole, like, mainstay of your exercise, but actually let's do all this other exercise to help bolster this activity that you love.
No, I love that approach, because instead of telling somebody what they're doing and that they love isn't sufficient and that they need to be doing other things as well, you're saying, hey, let's make you even better at your sport. This is how we're going to do it. And I think that's a way that you're far more likely to get buy-in and enthusiasm than, hey, stop doing pickleball so much and start doing this because you need to. I think it's a great approach.
I have that same conversation with a lot of these, like, athletes in specific, like I always think about like ultra marathoners that I'll talk to a fair amount, and them doing strength and core work. Like, that's how you sustain that. Otherwise, you get injuries. But I talk to them not as much from a perspective of injury prevention, but more of like, this is actually going to make you way better, and show them data around that. And here's how it's going to make you, not just running. Yes, running is an important component of your training, but all these other things are as well.
Love it. All right. Well, let's just transition into what, maybe a pretty brief discussion of recovery. But I think while we're on, while we've been teed up a topic on sports, if you call pickleball a sport, I think it's a sport.
Oh, it's totally a sport.
And by the way, listeners, if you haven't if you didn't catch Agassi's double pickleball match, so it was Agassi and Andy Roddick against John McEnroe and Michael Chang. So this was like several months ago, but it's a pickleball doubles match on YouTube. You can just go check it out on YouTube. If you look up McEnroe pickleball doubles, you'll find it. But
please tell me that McEnroe lost his mind and threw a pickleball at him.
Oh yeah, there were paddles thrown. Yeah, I won't give away any other spoilers. I don't think it's a spoiler to know that John McEnroe lost his temper in a competitive environment. But it was pretty phenomenal. There's a guest appearance by Steffi Graf. It's amazing. So really fun. But I'm watching that and I'm thinking, these guys really need to focus on recovery. A lot of them have not aged well, and you're looking at this older population that all of a sudden, let's say, is getting more involved in what we've agreed on as a sport, and how are they going to recover properly? And I think that recovery tips and general approach probably applies equally across all of our patients and all of us, regardless of our age. Maybe if you're 10 years old, you might not need much in the way of recovery. But if you're, by the time, my younger son competes in tennis, by the time, you see these 13, 14-year-olds, they're like foam rolling after a match, and they're, warming up before a match and stretching, and then they're doing active recovery and cooling down and all, it's definitely a part of training from the very early adolescence all the way through our athletic career. So, if you were going to distill recovery for me, Carl, like number one, what is it? Why is it important? And number two, sort of how do we know if we need more recovery? I think, we've talked about this in depth with Dr. Goodman when Mark's been on the podcast, and we've gone deep into like, overtraining syndrome and non-functional overreaching. I don't think we need to get super technical. I think we can put a link in the show notes to Mark's podcast on overtraining, which will have a ton of detail. But if you wanted to give people sort of practical tips on sort of what recovery is, why it's important, and how to know if you might need more of it, I think that'd be a good wrap up to a talk about senior pickleball.
Yeah, I guess I'd take it in terms of when I'm talking to many patients. It depends on the patient I'm talking to and their background or experience, in this, because there's different levels of knowledge base around recovery. But when I think of recovery, the main drive behind recovery is injury prevention, and also I think about it in sustainability, in consistency around exercise and what your goals are and trying to achieve. So thinking of that, you have to build in recovery time so that your muscle has time to recover from damage, essentially, and then rebuild. In addition, ligaments, tendons, having them have time to heal and repair that inflammatory process that occurs. But then also, just more of the systemic inflammation that can also happen. And then when I think of recovery, I think of there's recovery where it's like you're doing nothing. Then there's active recovery where you're putting in, mobility, stretching, and moving that body around so that you don't become more rigid and promote more injuries the next time you go back to that whatever activity that is, or whenever you stress the system again. So I think about it as like getting the system kind of ready to be stressed, so that way it can, so the system doesn't break. So I want people to stress the system, but also have the system have time to go back to baseline and then hit it again. And there's times where you sort of stack stuff on top of each other, but part of recovery, though, and I'm sure Goodman has like way more articulate ways and piles of data in his mind around this, but I think of objective measures, so things like HRV and what your sleep looks like, and those pieces of data that you can pull in. But more importantly, I feel like in the more time I spend talking to patients around this space, the subjective part of this is so huge. So how you feel, your HRV is kind of back to where it should be, but you're worn out. You're like feeling not ready to go and hit it again and perform it where you should be, or where you think you should be. Oftentimes you just need to recover more, and sometimes it's not just active recovery and mobility work, and foam rolling and light yoga, those sort of things. Sometimes it is true rest, and it depends on what your regimen is and like what you've built up, or the cumulative effects of stress on the system.
I mean, I think that's a great summary, right? I mean, we know that like under recovery, and is like closely related to non-functional functional overreaching. Yeah. You're trying to add some weight to your squat the next time you go to the gym, right? It's functional. Yeah. You're trying to gain more muscle mass and get stronger, right? Non-functional overreaching is when you're essentially not recovered sufficiently, and that overreaching isn't going to help you. It's not going to make you stronger, in that example. And the long-term non-functional overreaching is going to lead to overtraining syndrome. So continuous muscle soreness, pain, clinical or endocrinological issues. If you can just get in early and identify that you're pushing too hard, and whether it's active recovery or it's just full on rest. I know that there's also like questionnaires that people have used around like the recovery stress questionnaire for athletes, short recovery and stress scale. So there's multiple like structured ways to do it if you're working with a highly competitive or professional athlete, let's say. But I love your practical advice of, it doesn't really matter what your HRV tracker is telling you. If you're feeling burnt, you're probably burnt. And I think that this is something we see with a lot of our athletes and frankly with a lot of like people we know in our personal lives, where just taking a step back and actually taking a true rest day is really hard for people. Yeah. That's so valuable.
I think the only things I probably didn't say there is, we talk about your body and these objective measures, but also your own. But one of the things to always be integrating in there is to, we always talk about reflecting on your nutrition when you are feeling, you're feeling those warning signs of overtraining or not appropriate recovery, where you're just feeling chronically fatigued and irritable or not sleeping well. Looking at your nutrition, but also looking at hydration, and then and reflecting on your sleep and all the things that kind of tie into how you recover. And sometimes it's hard for people to be objective in that, and so sometimes I'll talk to people about training logs and documenting when they're really like trying to figure out what's going on, because it's so helpful. And sometimes it's hard to get that context otherwise of like, when they're saying like, yeah, I'm not doing so bad. Well, they're doing something 6 or 7 days a week, but it doesn't seem overreaching to them. But from an outside perspective, you're like, well, maybe. So those are the other things I, sometimes circle people back to and do training logs and sleeping and start to go back to the basics.
Love it. All right. Well, just to take us full circle, I'd say if you're mid 50s or older and you're starting off with pickleball, don't go play pickleball, singles multiple days in a row. Listen to your body. Let those ligaments and tendons catch up to what your muscles and your brain are doing, and make sure you build in some time for recovery. All right, Carl. Next time I see you on a pickleball court, you're going to be easily 75% as good as the rest of the people out there.
I don't think that's true, but okay. That's very nice of you. You're a good friend.
It's optimism, just optimism, buddy. Thanks, man. I appreciate this.
Thank you. All right.
That's all for this episode. Thanks everyone for listening. And if you're looking for more, be sure to follow us on social at WildHealthMD and head over to wildhealth.com or wildhealth.com/premium to become a patient and experience precision medicine for yourself.